Hi, I'm Sandeep Raina. Today we are going to discuss about a stock called Piramal Pharma. Now, before that, let's get into some history. The company is into three businesses. One is CDMO, second is the hospital business, and third is the consumer business. Now, the first business, which is CRAMS or CDMO, what we call is 55% revenue. Second business, which is a hospital business, is around 30 odd percent, and the balance, the consumer business, around 13 odd percent. Now, if I just talk about the profitability, consumer business is not making money right now. Hospital business is a good around 20% EBITDA business, while the CRAMS business, which is the CDMO, is currently making around 4 to 5%. Now, if you go back to history, before 21, the company was making EBITDA margin of closer to 25%, which post-COVID or during the COVID came down to closer to 9%. Now, the question is what happened? So the CRAMS business, which is the largest business, the CDMO business, what we call, took a big beating, and there were multiple reasons for that. One, I think there was not much investment happening in the biotech industry. Second, there was good labor turnover. Actually, few people left in this business. Also, which led to actually business not increasing the way it was expected, and that led to the decline in margins. So overall, the company started doing not so good. However, post in last 2 years, a lot of things have changed. Company has done a lot of investment. In fact, they have done acquisitions. In last 2.5 years, we can see around 3,500 crores of investment done by them, inorganic, organic both, which actually will give us a lot of fruits going forward. Now, if I just look at the revenue, I think the revenue broadly will go from 7,000 crores in 23 to 10,000 odd crores, so there's a delta of 3,000 crores, which is a 15% CAGR. While the game is margin profile was improved significantly. In 23, they did a margin of closer to 9%. We expecting that in FY24 they will do around 14% margin, and this eventually will go to 19%, 19.5% to be precise. This is still not, we are not still taking the peak margin the company used to make before 21 of 25%, and that is the upside that we can have going forward. So it's around 48% CAGR in last 2 years, in next 2 years, that the company will make on the EBITDA side. So PAT effectively they can make around 870, 880 crores of PAT in 26. Now coming to the PAT, after the PAT level, if I just look at the balance sheet, yes, they have debt, although they took around 1,000 crores from the market in the form of the rights. So that money actually was used to repay the debts. Around 860 crores of debt was repaid. So balance sheet is little better, but I think in next 2 years the company will make around 1,000 crores of cash flow and 1,200 crores of cash flow. To be precise, next 2 years 2,200 crores of cash flow can be made, which is very, very exciting. And there's no major huge capex also left, barring 24. In 24 there is some amount of capex still they will do, but in next 2 years after that the capex is not much, and that will be just maintenance capex. So that's why free cash flow also can be very interesting. Now, since we are talking about business, the CRAMS business actually can grow at good 15 odd percent, but the game for the business actually and for the company is the margins. This 4-5% margin can increase significantly, and that will give the big delta to this business. The other business, which is the hospital business, which will be growing at the normal pace, and the margin profile is reasonable. The third business, which is not making money, the consumer business, there the margin also will improve. Right now it's a zero EBITDA business, so they are just breaking even. So this makes company very, very exciting. There were issues they have sorted. The future looks very exciting. The PAT will grow at around 50 odd percent, because they'll make around 880, 870 crores of PAT going forward. And the market cap right now is around 18 odd thousand crores. Now we are getting this company's EV/EBITDA of 10 times, and broadly the PE is around 21 times. So we have to do a SOTP of this business, because there are three businesses, all are valued differently. Now for the CRAMS, which is the CDMO business, and the hospital business, generally, if I just look at the market, which is my competition, they are trading at 30 times, 25 times. This guy is trading right now only at closer to 12 times, 10 or 12 times, which makes a good case for us to actually see this, upside. Second, the third business, which is at 10 times, also should move up further. So broadly, I think a good percentage of money can be made in this business, which is very exciting. And we know that the CDMO business will improve, the quality of business will improve because he is getting into complex products, even more complex products. And so right now the complex product is just 30-35%, which will actually eventually move to 50%. That is the reason the margin profile will be changing. So it looks very, very exciting company to us. The target can be 116 next 1.5 years. So I think this company is seeing a lot of change. We have already seen the change. There's further expectation, a lot of changes going forward, and this should be bought in our portfolio. Thank you very much.